Right. So we're looking at the concepts in gynecology. Maybe most of the times you have seen them writing this. So they just write as GTPAL. So the full meaning of GTPAL is what? Gravida, term, preterm, abortions, leaving. So in summary, you're just trying to access, a woman that is actively getting pregnant and all of that. So you want to actually access how many times have she gotten pregnant, how many of these child actually died, all right, then how many of her children are living, all right. So for the GTPAL, it's just a system. It's a 5-part acronym. It's used to what? Used in obstetrics, because you want to summarize the patient's reproductive history. So it helps healthcare providers to be able to quickly access the pregnancy outcomes and potential risk, to see if a woman will give birth successfully or if it will end in issues. So for the G is Gravida, the total number of times this woman has been pregnant. Term birth, how many of her pregnancy actually crossed the 37th week. Preterm birth, how many of her pregnancies didn't actually reach the term time, that's 37 week to 41, but she gave birth within 20 to 36 weeks. Abortions, did she lose any pregnancy before week 20? Living children, how many of her children are alive, right? So this is just an example breakdown. Let me say somebody has 3 pregnancies. She delivered one at 39 weeks. She delivered twins at 35 weeks. She had one miscarriage at 10 weeks. Right? So Gravida totally. Okay, their Gravida will be what? Totally, she has been pregnant before 3 times. She's currently pregnant. That's 4. She gave birth to one baby at the right time. That's 1. She gave birth to one baby at the premature time. That's 35. She had a miscarriage at 10 weeks. All right. Then, one full-term child plus 2 twins and all of that. Okay. That's 3 of her children are living. Okay. So that's it for this.